Hello, my name is Dr. Foster Nazaire. I am a physician advisor at Palms West Hospital. A physician advisor is someone who works in hospital administration as a link between administration as well as nursing staff and doctors and the patients. I work very closely with case management in order to make sure that the patients are getting good care, but timely care, and I work with the doctors to make sure that when the patients are ready to be discharged, that they go to the right place. For example, if they are going home, we make sure they go home safely, or they could go to a nursing home. In addition, a big part of my job is to make sure that the quality of the care that the patients are receiving is of the best level. So I do a lot of different things. I work in healthcare, but also in business. Currently, I work for a small hospital called Palms West Hospital, which is part of a bigger group of hospitals called HCA. And basically, I trained as an internist back in Boston years ago. And while there, I realized I wanted to do administrative work. So I went and obtained an MBA after I finished my residency as an internist. So I worked primarily in internal medicine for a number of years. I was in private practice, but back in 2004, I made the transition toward administration in a hospital setting. I was inspired to become a doctor at a very young age because, like most of you, I wanted to help others. And I felt that as an internist, I would be able to do that, and it was very satisfying. But as I became older and more aware of the business side of medicine, I wanted to be part of that as well. That's why I went and obtained an MBA in order to increase my skills for the business side of things. And now I am able to do both, business and medicine. I actually was born in Haiti, and I came to the United States when I was 11 years old. I grew up in New York, and I went to school in a place called Wellesley College in Massachusetts. And I was a chemistry and philosophy major. From Wellesley, I went to Duke Medical School for my medicine. I am presently married, and I have 2 kids. My daughter is 7 and my son is 11, so they keep me very busy outside of work. Most of my time is spent with them. I love to read, and I spend a lot of time reading. I have been involved with TLJMS for a number of years, and primarily I would be called an ad hoc committee member. I'm always available for them whenever there's an event happening. Certainly, I have been to many of their presentations, and also I am able to help out whenever they need help at the hospital. My words of wisdom to students who want to be in medicine is primarily to go for it. I think it's actually a wonderful career opportunity, and what I want you to understand is that the sky is the limit. You may start out doing one thing, and just like me, you realize that you want to branch out into something else. That's okay too. So you can choose to be on the business side or the primary care side. You could become a surgeon. You could be an educator, which I have done. I have taught at Harvard for a while. And it's really endless. And I wish you the best of luck.